everyone, and good morning, all PhysioTV viewers. Today we have Dr. Aditi Beri, ma'am, with us, and she is a assistant professor in DS Brijla Jindal College of Physiotherapy and has a publication in various national and international journals. So, without any delay, we'll start with the session, ma'am. I'll share the screen.
Thank you for having me today. So today we'll be discussing about exercise as therapy, unlocking health in metabolic syndrome. Next slide. So chronic non-communicable diseases currently represent a major challenge as far as the global health is concerned. Recently, the World Health Organization has stated that NCDs including cardiovascular disease, diabetes and obesity account for roughly two-thirds of the worldwide deaths. So metabolic syndrome, basically it is a cluster of conditions that occur together which increases the risk for heart diseases, stroke and type 2 diabetes mellitus. Next slide, please. Next slide, please. So metabolic syndrome, it is a cluster of conditions that occur together and which increases the risk for heart diseases, stroke, type 2 diabetes mellitus, and which in turn is largely contributing to the global CVD risk. So any three of the following factors have to be present in order to be diagnosed as to have metabolic syndrome. So waist circumference of more than or equal to 80 in women and 90 centimeters for men. Triglycerides of more than or equal to 150 mg per dl, or if the patient is on regular drug treatment for elevated triglycerides. If the person has HDL of less than 40 mg per dl for males and less than 50 mg per dl for females, or again if he is on regular drug treatment for lowering the for low HDL. BP of more than 130 by 85 mmHg or on regular treatment of hypertensives, antihypertensives. Or if the person has fasting blood glucose of more than 100 mg per dl or on medical treatment for elevated glucose. So any of three factors, if they are present, then the person is labeled as having metabolic syndrome. Next slide. Prevalence of metabolic syndrome was estimated to be around 41.4% in Asian Indians. It was also concluded that prevalence of metabolic syndrome is age-related and is also more commonly seen in women. A systematic review also established that 1 in every 3 adults in India suffered from metabolic syndrome. It was more prevalent in females and people residing in urban regions. So the risk of the rise of metabolic syndrome and the associated risk of CVDs is as alarming at our national level as it is at the global level. Next slide. Metabolic syndrome, it is a complex pathophysiologic state which primarily originates from an imbalance of caloric intake and energy expenditure. And it is also affected by the genetic makeup of an individual and predominance of sedentary lifestyle over physical activity. So all these factors, the caloric deficit, if the intake is more, physical activity is less, and also the genetic makeup of an individual predisposes, then the risk of metabolic syndrome increases. So this epidemic has not developed suddenly but has increased over a period of years. Thus, again, it cannot be eliminated quickly or within a short span of time. It is going to take efforts at national and international level in order to reduce the burden. Now let's look at pathophysiology of metabolic syndrome. So as we discussed, basically the calorie deficit that arises from either overeating or decrease in the physical activity that predisposes to visceral obesity. So now visceral obesity is responsible for increase in leptin and reduction in the levels of adiponectin. So that will activate the neurohumoral system. Also, there is increase in the angiotensin receptor enzymes that will increase the ROS activation, which will again cause a state of chronic inflammation. Visceral obesity will also increase the free fatty acids, which will again decrease the glucose uptake, but the liver continues to produce glucose. So gluconeogenesis also increases and the uptake of glucose has reduced. So that in case will cause a state of hyper Yeah, that will cause a state of increase in the glucose levels, and also the insulin resistance is developed. So you have a state of hyperinsulinemia and hyperglycemia, but the insulin sensitivity is reduced. So there is insulin resistance, and as we discussed, there is a state of chronic inflammation. So both these things predominantly cause a state of metabolic syndrome. Next slide. So as we discussed, there is release of free fatty acids and pro-inflammatory cytokines because of the visceral fat. So that leads to lipotoxicity, low-grade inflammation and hormonal dysregulation. So these free fatty acids which are there, it also interferes with the insulin signaling. Hence, it causes reduced uptake of glucose by the muscles and adipose tissue. But as I mentioned, liver will continue to produce glucose, which is gluconeogenesis. So that will cause a state of hyperglycemia. So we have hyperinsulinemia and hyperglycemia, but the sensitivity is reduced. That is why it is not that efficient. So increase in free fatty acids, increase in VLDL, triglycerides, LDL, and reduced level of HDLs will also cause a state of dyslipidemia. Insulin resistance causes hyperinsulinemia, which again increases the sympathetic activity and sodium retention. So because of this, again, a person is predisposed to develop hypertension. Also, adipose tissue cytokines, which are increased, that will cause endothelial dysfunction and arterial stiffness. So both these factors will predominate and it will cause hypertension. So adipokines, that is TNF, previous like these. Adipokines, that is TNF alpha, IL-6 and resistance. No, previous slides, please. So adipokines will also cause a state of chronic inflammation. There is also increase in plasminogen activator inhibitor factor, which again increases the clotting risk. So both these factors produce a state of pro-inflammatory and thrombotic state. Next slide, please. So there is visceral obesity, insulin resistance, dyslipidemia, hyperglycemia and hypertension, and also a state of inflammation and thrombosis. So all these factors increase the cardiovascular and diabetes risk. Next, so this was about the pathophysiology. Now let's look at some risk factors for metabolic syndrome. So risk factors can be divided into modifiable risk factors and non-modifiable risk factors. So non-modifiable risk factors include age, gender, sex, genetics or the family history or ethnicity, and modifiable risk factors include obesity, physical inactivity, unhealthy diet, hypertension, dyslipidemia, insulin resistance, smoking and alcohol use. So there is scope of improvement in these modifiable risk factors. So if we plan strategies to address these modifiable risk factors appropriately and early, then it can help to reduce the risk of developing metabolic syndrome and the associated comorbidities. Next slide. So now these are some of the complications of metabolic syndrome. So as far as the cardiovascular system is concerned, it can increase the chances of coronary artery disease, peripheral arterial diseases, endothelial dysfunction. So metabolic and endocrine system, there is increased risk of type 2 diabetes mellitus, insulin resistance and also PCOS. As far as hepatic system is concerned, there are chances of non-alcoholic fatty liver disease, liver fibrosis, and the liver enzymes might be elevated. Renal system, chances of chronic kidney disease and nephropathy. Respiratory system, obstructive sleep apnea. Neurological, there are chances of dementia and cognitive decline. Musculoskeletal system, osteoarthritis, and it also increases the risk of developing colorectal, breast and liver cancers. And systemic effects, so there is always a state of chronic low-grade inflammation and prothrombotic state. Because of this, there is an increase in the all-cause and cardiovascular mortality. So looking at pathology and pathogenesis, we saw that visceral obesity is the main triggering factor for metabolic syndrome. So lifestyle modifications will play a very important role in altering the course of metabolic syndrome. So lifestyle modifications include weight management, dietary management, alcohol and smoking cessation, sleep management, stress management, and behavioral modification. Next slide. So today again we'll be looking at exercise as a major lifestyle modification for metabolic syndrome. So regular physical activity in any form is essential to reduce the risk of developing impairments that are associated with metabolic syndrome. So individuals can participate in either structured, supervised exercise programs that are conducted at various hospitals and outpatient clinics, or person can also indulge in some form of physical activity of their choice. So next slide, let's look at some review of literature wherein the importance of exercise is emphasized. So there is a systematic review and meta-analysis to analyze the effect of exercise training on clinical outcomes in patients with metabolic syndrome. So it compared, there was a comparison between aerobic group and control group. So it was found that in aerobic group, the BMI, body mass index, waist circumference, systolic and diastolic blood pressure, fasting blood glucose, triglycerides, LDL, it all reduced as compared to the control group. And there was also an increase in peak VO2 that was seen in the aerobic exercise group. Next slide. And they also said that combination of aerobic and resistance training also helped in reducing the waist circumference, increasing the peak VO2, systolic blood pressure decrease, HDL, and everything. HDL also significantly improved in that group. So this study concluded that exercise training improves body composition, cardiovascular and metabolic outcomes in people with metabolic syndrome. And in case of some outcome measures, isolated aerobic exercise also appears to be optimal. Next slide. So another systematic review and meta-analysis on supervised lifestyle intervention effects on outcomes and individual risk factors of metabolic syndrome was conducted, which included both dietary interventions and supervised exercise program. So this study concluded that there is low to moderate level evidence that supervised multifaceted lifestyle intervention improves multiple risk factor of metabolic syndrome. It also helps to reduce the prevalence of metabolic syndrome. So it concluded that healthcare services should thereby implement lifestyle intervention program for people with metabolic syndrome in order to improve the health outcomes. A rapid review on home-based exercise program for adults with overweight and obesity was designed to conceptualize and assess the availability of evidence and effectiveness of home-based exercise and physical activity programs. So total of 15 studies were included in this review. So this review identified that there is lack of published evidence-based population-specific home-based programs for overweight or obese adults. So many studies included in this review have varied reports of significant positive effects of exercise program on weight management and related outcomes. So some reported qualitative data identifying barriers to physical activity and preferred program components. There was also a randomized control trial for 12 weeks, which was conducted to evaluate the effectiveness of 12 weeks of yoga-based lifestyle intervention versus just dietary modification on cardiometabolic risk factors and continuous risk score in Indian adults. It was published in 2020. So the age group included was 20 to 45 years. And this study concluded that yoga-based lifestyle intervention was more effective than usual dietary intervention in terms of both the risk factor profile as well as the continuous score. So review of literature also suggests that exercise hold an important role in the lifestyle modification and reducing not just the prevalence of metabolic syndrome, but also the risk factors or the comorbidities associated with metabolic syndrome. Next slide. So now let us just discuss the role of exercise or how exercise is actually going to help in improving the metabolic profile. Next slide. So exercise basically it increases the glucose uptake by skeletal muscles via the GLUT4 transporter activation. So it also enhances the insulin receptor sensitivity, thereby reducing the insulin resistance, which is a key factor of metabolic syndrome. As we saw, there is insulin resistance. So insulin is secreted in excess of amount. So there is hyperinsulinemia, hyperglycemia, but because of the affected insulin receptor sensitivity, the increase in glucose is seen. So that is why exercise will help to improve the insulin sensitivity. Also aerobic exercises, so a combination of aerobic and resistance exercises will help to decrease the visceral adiposity, which decreases the release of free fatty acids and pro-inflammatory cytokines. So it all starts from visceral obesity. So exercise will help in targeting this basic factor. Also, exercise causes an increase in HDL and decrease in the triglycerides and LDL level. So this will help to improve the lipid profile, and also it increases the activity of lipoprotein lipase, thus further aiding the fat metabolism. Next slide. So it also helps to improve the endothelial function and increase in the nitric oxide availability. So this produces vasodilation. It also helps to reduce the sympathetic tone and resting heart rate and lowering blood pressure. Exercise also produces some anti-inflammatory effects. So it suppresses the chronic low-grade inflammation that we have already seen by reducing the inflammatory adipokines and thereby increasing the anti-inflammatory cytokines. So IL-10 and adiponectin activity will go up with exercise, and which will produce an anti-inflammatory effect. So exercise is also known to enhance the oxidative capacity of skeletal muscle and thereby improves the fat oxidation, leading to better energy metabolism and reduced fat storage. So it will also help to improve the mitochondrial function. Next slide. So regular exercise will promote angiogenesis, and it will help to improve the arterial compliance, thereby reducing the risk of atherosclerosis and CV complications. So by improving the arterial compliance, it is also helping to reduce the risk of hypertension. And exercise, as we all know, exercise increases the lean muscle mass and it reduces the total body fat, thereby improving the basal metabolic rate and overall metabolic health. So body composition and weight control will also help with the help of regular exercise. So in addition to all of these effects, there are some separate or exclusive effects of aerobic exercise and resistance exercise. So aerobic exercise will also help to improve the cardiovascular fitness. It will also help to improve VO2 max and cardiac output. It also increases exercise tolerance and overall functional capacity. There is also mental and hormonal benefits that can be seen. It helps to reduce the cortisol and adrenaline level, thereby reducing the stress levels. And it also promotes release of happy hormones, which will promote enhanced mood. So resistance exercise, on the other hand, will help to enhance the muscular strength and muscle function. So it will support better glucose metabolism even at rest due to active muscle tissue. So the basal metabolic rate will also go up. It will also help to promote the hormonal balance. It increases the testosterone, growth hormone, and IGF-1 levels, which will support the metabolism and lean body mass. It is also seen to reduce the cortisol levels, which is associated with stress and the fat storage.